Hair loss, or alopecia, is a common condition that affects millions of people worldwide. Although most people often associate hair loss with aging, it impacts both men and women of any age. According to the American Academy of Dermatology, over 80 million people in the United States alone suffer from hair loss, with 50 million men and 30 million women experiencing significant thinning or balding. Globally, studies estimate that around 60% of men and 40% of women will experience some form of hair loss by the age of 50. This is attributed to various factors including aging, genetic factors, hormonal imbalances, stress, nutritional deficiencies, autoimmune diseases, and side effects of medications. One of the major side effects of hair loss is the profound psychological effects this condition has on the person. Understanding the mechanisms behind hair loss is key to prevention and treatment. This is why in this video we will reveal to you 7 reasons why you might be losing your hair. Now, without any further ado, let's get to it. Number 1. Androgenetic alopecia. Androgenetic alopecia is the most common cause of hair loss in both men and women. It is a genetically determined condition that involves the miniaturization of hair follicles due to the action of androgens, which are male hormones, particularly dihydrotestosterone. Dihydrotestosterone binds to androgen receptors in hair follicles, especially in genetically predisposed individuals. Over time, the hair growth cycle shortens, leading to thinner hair strands and eventually the death of the hair follicle. A landmark study published in the Journal of Investigative Dermatology in 1998 explored the role of dihydrotestosterone in androgenetic alopecia. The study revealed that men with androgenetic alopecia had higher levels of 5-alpha reductase, which is the enzyme responsible for converting testosterone to dihydrotestosterone in their scalp tissue. These men with elevated dihydrotestosterone levels experienced a more rapid progression of hair loss compared to those with lower levels. Moreover, the use of finasteride, a 5-alpha reductase inhibitor, reduced scalp dihydrotestosterone levels by up to 60%, slowing down hair loss in 80% of participants. Number 2. Telogen effluvium. Telogen effluvium is a term that describes hair loss induced by stress. This type of hair loss occurs when a significant number of hair follicles prematurely enter the telogen or the resting phase. Under normal conditions, only about 10 to 15% of hair follicles are in the telogen phase at any given time. In telogen effluvium, this percentage can rise to 50%, leading to widespread thinning. This condition is usually triggered by physical or emotional stress, surgery, or illness, all of which can disrupt the hair growth cycle. A study published in the American Journal of Pathology in 2010 found that individuals who are exposed to severe emotional stress experienced a 30 to 40% increase in hair shedding within 2 to 3 months of the stressful event. The study showed that stress elevates levels of cortisol, which is a hormone that can affect the hair cycle by shortening the anagen or the growth phase and prolonging the telogen phase. Nutritional deficiencies. Hair follicles are highly active metabolically and require a variety of nutrients for optimal growth. Deficiencies in vitamins such as B12, D, and biotin, minerals like iron and zinc, and proteins can impede the function of the hair follicle. If you suffer iron deficiency, for example, the oxygen supply to hair follicles will be disrupted. Consequently, their growth will be impaired. Similarly, a lack of biotin affects keratin production. This is the key protein in hair. A comprehensive review published in Dermatology and Therapy in 2019 examined 31 studies linking nutrient deficiencies to hair loss. The results indicated that iron deficiency was present in 72% of women with hair loss, while 40% had low levels of vitamin D. Biotin deficiency, although rare, was linked to hair thinning in 38% of patients with unexplained hair loss. Number 4. Autoimmune conditions. Alopecia areata is an autoimmune disorder in which the body's immune system mistakenly attacks healthy hair follicles, leading to hair loss. The mechanism involves an aberrant immune response, particularly the activation of white blood cells called CD8 plus T cells, which target hair follicle cells. This leads to localized inflammation and disruption of hair growth in patches. In a study published in the New England Journal of Medicine in 2015, several immune pathways involved in alopecia areata were identified, including interferon, gamma signaling, and the JAK-STAT pathway. A trial of inhibitors of the JAK-STAT pathway, such as tafasitamab, resulted in hair regrowth in 50 to 60% of participants after 3 to 6 months of treatment. This is good news because this suggests that immune modulation can reverse the condition. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 5. Hormonal imbalances. Hormonal fluctuations, such as those seen in postpartum women or individuals with thyroid disorders, can significantly impact hair growth. In postpartum hair loss, the sudden drop in estrogen levels following childbirth leads to a shift of hair follicles into the telogen phase, causing diffuse shedding. On the other hand, thyroid disorders can significantly impact hair health. The thyroid gland regulates metabolism, and its hormones play a crucial role in maintaining the hair growth cycle. When it comes to thyroid hormones, things can go wrong in one out of two ways. Either the levels of the hormones become low, which is known as hypothyroidism, or they can become too high, which is referred to as hyperthyroidism. In hypothyroidism, the lack of adequate thyroid hormone can make the hair dry, brittle, and fall out more easily. Conversely, in hyperthyroidism, excessive thyroid hormones can accelerate hair loss. Polycystic ovary syndrome is another condition closely tied to hormonal imbalances, especially in women. Polycystic ovary syndrome causes an overproduction of androgens, which can lead to thinning of the hair or male pattern baldness in women. This condition is often accompanied by other symptoms like irregular periods, acne, and weight gain, and hair loss can be a distressing symptom of the underlying hormonal imbalance. A study published in Clinical Endocrinology in 2012 examined postpartum hair loss in 200 women. It found that from 40 to 50% of women experienced increased shedding during the first 3 or 4 months postpartum, with full recovery typically occurring by the 12-month mark. In cases of hypothyroidism, a study in a journal called Thyroid in 2017 found that up to 50% of patients experienced hair loss, and treatment with levothyroxine showed improvement in the hair density in 80% of cases within 6 months. Number 6. Medications and medical treatments. Certain medications can interfere with the hair growth cycle, causing drug-induced hair loss. Chemotherapeutic agents, such as doxorubicin, are particularly notorious for inducing anagen effluvium, where hair follicles in the growth phase are damaged. Other drugs, such as beta blockers, antidepressants, and isotretinoin, can induce telogen effluvium by pushing hair follicles into the resting phase prematurely. A study published in the journal Cancer Research in 2008 observed the effects of chemotherapy on hair follicles. The study found that doxorubicin caused DNA damage in rapidly dividing cells within hair follicles, leading to apoptosis, also known as programmed cell death, and widespread hair loss. In addition to that, the study also showed that cooling the scalp during chemotherapy reduced hair loss in 60 to 80% of patients by minimizing drug exposure to the scalp. Number 7. Traction alopecia. Traction alopecia is caused by prolonged tension or pulling on the hair, often due to wearing hairstyles like tight ponytails, braids, or extensions. The constant mechanical stress damages the hair follicles, causing them to weaken over time. If the tension persists, it can lead to permanent follicle destruction and scarring. A study published in the Journal of the American Academy of Dermatology in 2011 investigated the prevalence of traction alopecia in women who frequently used tight hairstyles. The study found that 31.7% of women with these styles had signs of hair loss, compared to 7.6% in those who did not. The researchers highlighted the importance of early intervention to prevent permanent damage to the follicles. So, these were the top 7 reasons why you might be losing your hair. Now, we want to hear from you. Have you noticed any changes in your hair health? What do you think might be contributing to it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.